We have been observing for the past 2 months that in our hospital as well as many of the children hospitals in Chennai, a large number of children are brought with complaints of cough, cold and fever, respiratory complaints. There has been an increase in the number of cases attending hospital as outpatient, and unfortunately some of them get admitted for complaints of pneumonia. Majority of the mothers, also parents, complain to us, "Sir, the child is having cough, cold, fever. We came to you 10 days back and you gave medicines. Child became all right. Again child is having cough. Sir, this is the third time child is having cough and fever." So we wanted to analyze why this is happening. Some of the tentative reasons are as follows. Number one, as all of you know, that during the year 2020 and 21, there has been outbreak of COVID. As a consequence, there have been lockdowns. There was not much of mingling of people. The crowd was less. Overcrowding was less. Schools have not opened. So there was no chance for admixture of children. So the question of transmission of infection from one child to another child doesn't arise. But with COVID epidemic almost in its last legs of existence, what we are seeing is the schools are open. There are more chances for children to mingle with each other in the schools. So infection in one child spreads very easily to another child. This is one of the reasons why there has been an increase in the number of children afflicted with respiratory infection. The second point is, we also got some reasons to suspect that there has been some mutation in the viruses that usually cause respiratory infections. There is a mutation, and as a consequence, the virus has achieved some amount of virulence. This may be one of the reasons. So what is happening is, children come frequently to us and we prescribe some medication, paracetamol for fever, some cough syrup. And the general impression is symptomatic relief they obtain, but they come to us again with the same complaints. So what we will advise to the parents is not to get panic. This is a normal happening which is happening to the most of the children, and we get large number of mothers with the same complaints. There is nothing to panic. Majority of the infections are very mild and self-limiting. It goes on its own with whatever little medications we give. If the cough persists, give them some 5 to 10 ml of honey, which is a home remedy, which is very, very effective. So that is the only thing you have to do. For God's sake, do not self-medicate your child. Please take your child to a qualified doctor, get him examined, give some drugs, and the child will become all right. That is the only thing. And those children who unfortunately get admitted also, we have seen the outcome is good. They get cured, they come out of their illness. So the most important message for parents is, don't get panic. Whenever child gets some mild symptoms, take to your doctor. You can try honey as a home remedy. And this illness is only self-limiting, and this will last for only 1 or 2 months with the onset of monsoons and lasting of monsoons. Thank you very much.